there. We're so excited to be sharing IDHAs Vision for Transformative Mental Health with you today.
My name is Jessie Roth, and I'm the co-director of IDHA. I come to this work as the family member of somebody with lived experience, my older sister, who was diagnosed with bipolar disorder when she was young. And when I was just entering college, I watched my sister experience her first inpatient psychiatric hospitalization, and the experience of watching her navigate the public mental health system really inspired my activism in this work. After that, I studied a lot about the MAD movement and alternative approaches in my undergraduate education, which really was kind of a perfect example of how the personal can be political for me. And in the years since then, I've also come to identify as a person with lived experience myself, finding my way to this amazing community at IDHA as an artist, activist, and a community organizer as well.
And I'm Jasmine Russell. I'm the co-founder of IDHA. I'm also a mental health educator. I also come to this work with my own lived experience as a trauma survivor, as someone who's been given multiple different labels, but found my own unique path developing alternatives outside of the mental health system. And in my past, I've also had the privilege of working in crisis in the mental health system through home-based crisis intervention, supporting children and families coming out of the inpatient unit, and also having worked in the system as a peer specialist in the open dialogue approach, which is one of the most innovative programs for supporting those who are diagnosed with first episode psychosis. Now I work as a holistic health practitioner. I'm excited to share with you what we have going on in IDHA.
So to share a little bit about who we are a growing community of mental health workers, clinicians, psychiatrists, current and prior service users, as well as advocates, artists, and survivors of trauma. And we're all interested in exploring this link between personal and societal transformation. So really we're trying to bridge the grassroots with clinical innovation, bringing together a whole host of stakeholders and actors for really comprehensive change. So our mission is to proliferate an understanding of mental health care that acknowledges and addresses the numerous contexts in which our mental health exists. And we have a vision of a new transformative model of mental health, which Jasmine will tell you about in just a little bit, which really focuses on shifting oppression, centering lived experience, and advancing holistic practices that really consider all aspects of a person. And yeah, again, with the goal of both individual and community transformation.
To give you just a brief overview of some of our history, we've been around since 2016, which is when myself and Dr. Peter Stastny met with a shared understanding of some of the shifts that really needed to happen in terms of how we think and talk about mental health. Both of us had spent a lot of time doing peer advocacy, and we also really felt that an educational institute for mental health would really have to be collaborative and involve people with lived experience in a huge way. So we started with that understanding, and by 2017 we had our first training series in collaboration between clinicians and people with lived experience called Rethinking Crisis, which was an in-person class series in New York City. And by 2018 we had our largest in-person training yet, called Experience Transforms Practice.
Now, following the success of Experience Transforms Practice, we really grew our community, added a bunch of core organizers, and that was also the year that I joined IDHA as co-director, kind of in the context of an organizational development project to develop our structure at the staff, board, member level, and so on. And since then, we've had a couple of virtual training series, which have enabled us to scale our work not only nationally, but even internationally. So we're really excited with the new growth that we've had and continuing to add to our community looking forward. So what do we do at IDHA? We implement our programs through these three main tactics, the first being education and training. Through our training, we offer innovative courses. As Jasmine mentioned, a few examples. They are all led in collaboration by those with experience and professional training. And our courses cover a wide range of critical, timely, and socially relevant topics. We also offer community events, which are slightly less formal spaces to our training, but also about shared knowledge and critical dialogue. And again, always about bringing peers, clinicians, family members, and anyone else who's interested together with the goal of shifting how we practice mental health care. And lastly, advocacy and movement building. We're really interested in campaigning and organizing alongside other movements that are related to transformative mental health, such as disability justice, environmental justice, racial justice, and forging those partnerships to fuel truly cross-movement change. And to give you an idea of what this looks like in practice, right now we're hosting a fall 2020 virtual training series called Healing Systems. And this class is really about examining the macro, meso, and micro levels of healing. So the first class that we did in October was about deconstructing the landscape of social services. We recently did a class in November about open dialogue, which is a really unique modality that integrates multiple perspectives and encourages that dialogue, which is so important for healing. And lastly, in December, we're going to be doing a class on somatics and internal family systems, so looking at the more micro aspects of healing. And community events, this is just a brief overview of what events at IDHA can look like. We offer dialogues, workshops, trainings on all sorts of topics. So we've covered things like the history of protests against the APA, movement workshops, and we have done a program called Mental Health Trialogue, which is really embodies what we care about the most at IDHA, which is getting all of the different voices into the room and all are heard equally, clinicians, peers, family members, and others. And for advocacy and movement building, this is really the newest dimension of our work, which started earlier this year in May. We engaged around the documentary Bedlam that was put out by PBS, and we wrote an open letter to PBS, really centering the importance of lived experience, which we thought was not centered in that film. So we had, our open letter was signed by now more than 85 mental health, disability, and social justice organizations. And we followed that letter with a community discussion that really centered the voices of lived experience, talking about the film. And then following that, in September, we did a really successful event called Decarcerating Care, which again, like everything we do, centered the voices of survivors, service users, and folks with lived experience, talking about non-police response to mental health crisis.
So at IDHA, we're really starting with this question of what does a model of mental health look like that really centers and values both personal and societal transformation? And with that question, we understand that the current model that we have is really acontextual. It doesn't do justice to the multitude of factors that really impact a person's mental health. And there are so many other models and other frameworks for understanding mental health, which all hold a different piece of the puzzle. So we're starting with the idea of what has really happened to someone rather than what's wrong with them, and opening up spaces that offer choice and different ways of understanding our pain. So with that, IDHA is really building a whole new model of mental health that's rooted in transformation. And this model has three main parts that we've identified. The first is having an understanding of systemic change. What does a society look like that really understands the impact that society has on our bodies, minds, and communities? Part two is uplifting experiential knowledge. So really honoring lived experience as one of the most powerful forms of knowledge creation that we have. And number three is holistic care. So uplifting frameworks and voices that really bring us a more complex, more nuanced understanding of our personal and collective contexts. To go a little bit deeper, what we mean by systemic change is individual rights plus having a structural and a power analysis. So if we look at our current traditional mental health framework, we do love to throw around terms like environmental factors or social determinants, but we really don't quite think very often about what we actually mean by those things. There are so many ways that the mental health system itself really perpetuates or mirrors our broader culture, including policing, incarceration, coercion, systemic racism, and so many other things that have a huge impact on our mental health. So having a structural analysis really means reflecting on how the system itself can perpetuate some of the problems that it's seeking to solve. And what this looks like in uplifting a new system would be having access to less restrictive alternatives, such as respite centers, peer-run programs, such as the open dialogue approach, understanding that we need a plethora of different models and that there's no such thing as consent without choices. We also need to begin to center conversations around race and oppression and the impact of that on mental health, and start to replace cultural competency with structural competency. The second piece here is experiential knowledge. So, as we've both mentioned, valuing lived experience as highly as professional training. So, in our current system, some of the issues we see are having a culture of expertism, having so many programs in mental health that are oriented more towards psychoeducation than learning with someone, or more focused on compliance rather than collaboration. So, what valuing lived experience really looks like in practice is going beyond terms like person centered or being inclusive, but really starting with what survivors and peers are saying about the system, about what we need, and what's truly helpful. It also means having more survivor led training, research, models, and practice, and really partnering and privileging the knowledge of advocates and peer specialists, as well as doing cross movement organizing. And this final piece to transformative mental health is holistic care, which for us means not just understanding the intersections between mind, body, and spirit, or how we make meaning of the world, but also uplifting multiple voices, frameworks, solutions, and many different practices for healing. So, some of the issues for this is that really, mental health services traditionally are less about healing or transformation and tend to be more about symptom management and assessment. There's very little therapy that actually happens in institutions, and we don't have as much concern as we need to about providing housing, good food, basic human needs as a form of care. We're so focused on finding the right answer or finding biomarkers for mental illness that we're really missing so much of the nuance and complexity here. So, what holistic care really looks like in practice is going beyond social determinants, exploring the whole picture of the context that a person is in, of what's really contributing not just to some kind of biomedical disease, but really seeing mental health issues as being adaptive to our environment, and understanding the deep interrelations between mental, emotional, physical, spiritual, societal, interpersonal aspects of health, and understanding that emotional pain at its core can actually be generative and can actually bring us together. So, transformative mental health is an understanding that human suffering, mental difference, and the full range of our emotions can be a catalyst for generative change rather than a pathology. And some closing words here from someone that we really admire at IDA, Adrienne Marie Brown, who says, "I think it is healing behavior to look at something so broken and see the possibility and wholeness in it." If you have been watching this and you have any thoughts, any questions, any shares, we are so happy to engage with you. So, we have an online school for transformative mental health. We use the platform called Mighty Networks. And once you become a member of IDA, you have access to this online member platform and database where we love to share resources, have critical dialogue, and you can network with all of the other people that are involved in our transformative mental health network. And if you feel like contacting us, here's our email, our website. You can join us on Facebook, on Instagram, and on Twitter. We are in all of the social places, and we hope to see you soon.